We do things quite differently in some ways at the WISEMedCenter. Hello and welcome to this edition of the Wise Medical Minute. Today I've been asked to talk about what to expect when you're having a body contouring procedure. Now, when I refer to body contouring procedures, I'm specifically talking about procedures where liposuction is the core of the procedure that's taking place. But we've had two motivating inquiries by actual patients this last week, and they pointed out to me that even though they were really pleased with their results, there were surprises on the day of the procedure that they did not feel prepared for. So the purpose of this video is to help prepare people for the day of their procedure so they know what to expect. Now, the first point I want to make in that regard is we do things quite differently in some ways at the WISEMedCenter. I've had occasion to work in several ORs, maybe a dozen or more, other than my own. And I've had occasion to be trained in probably a dozen different settings. And I've had the opportunity to train almost 20 physicians, surgeons, and plastic surgeons who are learning liposuction. And that exposure has made me aware of how other people do stuff. So what I want to emphasize today is how we do things, and especially those things that we do somewhat differently. Now, one of the thoughts I have to stress, and this is just so when my staff looks at this video, they'll be reminded, is we have written documentation of the things that people are supposed to do preoperatively that is supposed to be distributed during the pre-op visit. And every once in a while that falls through the cracks, so I want to make sure we make that a policy going forward. And for patients who I'll refer to this video, make sure during your pre-op visit that you get the literature that we provide routinely that tells you about what to expect, what to bring, and what not to do and what to do before a procedure. So those documents are readily available and are available even when not in the context of scheduling a procedure. So there's no secret, it's not top secret information that you gotta beg for or pay for even. But if you're scheduled for a procedure, you're supposed to have it. Now, we don't use general anesthesia for our procedures. We've experimented with it, and it's just more trouble than it's worth. The benefits are not justified by the increased risks, complications, expense, and just general hassle. And the advantages of having a semi-awake patient, we'll talk about some more as we go. So most of the things that are different about how we approach body contouring are on that basis, because we're working with awake patients who are sedated. They probably fall asleep several times during the course of their procedure. More than half the time they don't even remember half of what went on. But technically they're awake, or at least arousable, and that gives us lots of advantages and reduces lots of risks. So that's one of the main points I want to emphasize as far as what to expect. Now, before we even start a procedure, the patient will spend at least an hour with the nurse and or surgical tech, and being made aware of what to expect at the last minute. But also during that period of time, we verify that you've had your preoperative medications, antibiotics in particular. We like to have given you a little bit of a sedative to relax you. We want you to have had a good night's sleep the night before, because you're going to have a busy day the day of your procedure. Now, our procedures take longer than most places. I'm not ashamed of that. I can knock out a case in an hour and a half too if I wanted to. But a typical patient is going to be with us at least 3 hours. 6 hours is not rare. So we don't rush. That's the one thing I don't do very well, is rush. And I'm not going to try. But meanwhile, that's something that people sometimes don't expect. So we want you to know that you're going to be with us at least half a day, if not most of a day, when you have one of these procedures. Now, I was specifically confronted, I'll say, about the fact that my nurses like to use a Foley catheter during our procedures. Let me explain why. We monitor your urine output because sometimes the absence of urine output is a warning that other things might be going on, number one. Number two, when you're on a table for 3 hours, 6 hours, or sometimes longer, you don't have an opportunity to get up and go to the bathroom. More importantly, if you do have to get up and go to the bathroom, it means you have to be re-prepped. Your whole area that we're working on has to be re-sterilized. And we re-sterilize you every time we reposition you anyway. But if you've been to the bathroom, that re-sterilization process, adds another half hour to your case. So it's kind of for nursing convenience, to be honest. But it allows us to move forward and constantly be working towards getting our goals accomplished. So the Foley catheter, catheter in your bladder, is one of the things that was a surprise to a patient recently. So I wanted to be sure we added that to our what to expect. Now, every patient is monitored continuously in terms of their blood pressure, in terms of their pulse rate, and we do oxygen saturation, and sometimes we do even EKG monitoring continuously during the procedure. Young, healthy patients, we skip the EKG, but we continuously monitor pulse and pulse oximetry on everybody. So you'll hear the beep, 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 and all those noises that get to be kind of annoying when you're trying to fall asleep, but it lets us know you're okay. Another thing that some people found annoying, when you are sedated and you just want to sleep and y'all do what you gotta do, we wake you up periodically because that's as good as any other vital sign. There's a whole lot not wrong with you if you can talk to me. So that's irritating when people want to be asleep sometimes, but that tells us that a lot of stuff is okay if you're able to talk normally and etc. Now, one of the biggest surprises that we usually don't forget to tell people about is during a procedure, it's going to be wet and it's going to be messy. In previous videos, we've talked about the use of tumescent anesthesia. So I refer you to those videos to get a better understanding of how we numb people up for liposuction. But the point I want to make here is that tumescent fluid that we use to numb you up with flows freely. It flows into the fat, it flows out of the tiny little incisions that we make to get to the fat. So we use the tumescent fluid judiciously, and sometimes it's under pressure. So as we start to anesthetize an area, inevitably small amounts of the fluid spill out of the tiny little 4mm incisions, and basically it ends up a wet and messy stretcher, and you gotta lie in that stuff for those hours. So the wet and messy is just part of it. And we like you to be aware that's not abnormal, that's not a problem. And it's kind of my insurance that we're not giving you too much anesthesia, because I'm very liberal with how much I use, and I know I can always subtract that part that's spilt out on the table and you're not gonna get toxic. But bottom line is, the tumescent fluid is red and it looks like it's bloody. And even in the context of some legal expert kind of witness cases, I've had to describe this fluid under oath in front of a bunch of lawyers. We've taken that red stuff that you're lying in, we've actually measured the hematocrit on it. Hematocrit is the percent of red cells in blood. and it's less than 5%. But you put 1% blood in anything, that anything's going to be red. So it's disturbing to see, but we check your blood counts before your procedure. We're not going to let you bleed out, but most of that's normal saline and a little bit of lidocaine and a little bit of several other medications that you're lying in, and it's not blood. It's less than 5% blood. So the wet and messy, get used to it. I'm not going to apologize or try to prevent that because that's a safety factor. Now, we can sometimes be accused legitimately of being a little conservative in using pain medicines during and even after our procedures, mostly because people don't really need it. But when it's necessary, we will use it, but there are risks with too much of the pain medication. Both the sedatives we use to relax you and deal with the anxiety, which I think is more important, and the pain meds that we can sometimes use as an adjunct have a risk of something called respiratory depression, okay? And if you're using both at the same time, these drugs are synergistic and they can make that particular side effect or complication even more likely to happen. Now that's even more important when people tend to be overweight. Sometimes they have, whether diagnosed or not, sleep apnea kinds of syndromes. And because we don't know ahead of time that you're not one of those folks, those people are particularly sensitive to the respiratory depression. They can literally stop breathing if you give them too much medicine. Usually the anti-anxiety medicines alone don't cause that problem. Modest doses of the pain meds added to it, the risk is minimal. And obviously we're prepared if somebody stopped breathing, we're going to breathe for you. But we don't like to have to do stuff like that very often. We're talking, almost never with over 3,500 cases. But anyway, the bottom line is when you need it, it's available, we use it, but I tend to be conservative in that regard because the risks just aren't justified based on what little benefit there is. Now, the other area that we're sometimes a little conservative is on positioning. I'll use we're more liberal on positioning. Now, one of the advantages of a semi-awake patient is you can reposition them. And you have to understand when we're doing liposuction, we're working with straight instruments, sometimes 35 millimeters long. The short ones are 35 centimeters long. The short ones are 15 centimeters long. I don't use the larger bore cannulas that you hear about that leave people lumpy and bumpy. I don't own anything much bigger than 4 millimeter in diameter. So that was a concern of a patient recently, so I promised to mention it in this video. But we don't use some of the more aggressive tools available to surgeons that have an increased risk of things like skin necrosis, hematoma, seromas, stuff that we rarely see. So I don't plan to change my practice. The downside of that philosophy is it takes us longer. I could use a 5 millimeter or a 6 or an 8 millimeter instrument and knock out a case in half the time as it takes me with my little 3 or 4 millimeter instrument. But people recover quicker. My patients are back to work in 2 days, sometimes 3. And I think those benefits justify the extra time it takes to get a procedure done. Now, let's talk about noises. That's another area where we haven't always adequately prepared our patients. It gets noisy in that procedure room. There's noises from the monitor we talked about, the beep, 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 beep with your heartbeat. There's noises from the technology. Some cases we use the Vaser, which is ultrasound. That's probably the most annoying noise. The Vaser is conducted under the skin through your body to your eardrum, and so for the patient that noise is even louder than what we hear in the room. So So when we're using the ultrasound assisted liposuction, you're going to experience that irritating noise while we're emulsifying the fat. You can learn more about that in a previous video. We did a lot on the technologies using liposuction in a previous video. We sometimes use one of two different types of vibrational technology. We have both the VibraSat and the tickle, the Uromi system. I think the FDA made them stop calling it tickle, but it is ticklish sometimes. And basically that vibrates, and the compressor that runs it is noisy. So you'll hear the compressor going on and off every once in a while, and that can be scary. So if you know it's going to happen, you don't have to be alarmed. I use that technology more than 80% of the time during the tumescent step when I'm numbing people up, because it reduces the amount of pain associated with getting numbed up. And probably half the time we use it for the aspiration part whenever we're not doing a fat transfer. So the noises and the vibration associated with the vibrational technologies, if being used in your procedure, is important. Now, sometimes we have a laser that we use for things like skin tightening or skin smoothing or removing a little extra fat here and there. The laser, we work with that, and it has its own little beep when it's on and beep when it's off. And when you hit the pedal to turn it on, it makes noises, and it can be scary. So I'd like you to know that if we're using a laser, it's going to have its own set of noises. The other noise, speaking of noises, we talked about that already. The other noise that we sometimes underemphasize is the staff talking to each other. And if you're going in and out of sleep, I think I need to have my staff shut up sometimes. I think is what I'm going to start doing. But people hear things when they wake up, and they don't realize they missed half the conversation while they were asleep. So I think we're guilty of saying things we assume people aren't hearing and not listening. So we're going to make some adjustments in that regard going forward. I had a complaint recently, so your complaint is well received. Now, speaking of lasers, the other thing you might notice when you wake up is you're in the dark. Now, there's an aiming light that tells us where the tip of the laser is under your skin. And I can't see that aiming light with the lights on, so we turn the lights off. So if you wake up in the dark, you know the laser's being used. So don't be stunned by the fact that somebody's in here working on me in the dark. What's going on? But the laser has an aiming light that is more easily visualized in the dark. So I know where I am if I have the lights off, and we don't want the laser somewhere we don't want it to be. So that's important, and don't be alarmed when you see us working for at least a short period of time in the dark. Now, we talked briefly about the repositioning, and that's getting to be even more of an issue now that people have learned that it's not all about big boobs or a big butt. It's about a narrow waistline sometimes. Okay, and to get that small waistline all the way around, that 360 they're now calling it, you have to be repositioned multiple times to get a good job done. So that's a major advantage of not using general anesthesia. If someone's unconscious under general anesthesia, you can't reposition them as effectively as we can with our semi-awake patients. Now, we talked about the noises, we talked about the sounds. Let's talk more about the things you will see. I mentioned in passing the tumescent fluid. I won't belabor that any further. But you will also see your own fat. And it can be a disgusting sight, but I almost view it, especially when patients are a little overweight, as a bit of an aversive conditioning. So I like whenever you go to have those Twinkies or those donuts or the French fries in the future, I want you to have flashbacks of what you saw in that canister with your fat that was sucked out. So it might make it easier for you to resist the temptation of that extra serving of fried chicken in the future. So you will see the fat. It is not a pretty sight sometimes, but it looks beautiful to me. It lets me know I'm doing a good job. But that's one of those things that sometimes surprises people. So we like to make you aware ahead of time that it's there. Now, towards the end of every procedure, by the time you wake up, you're ready to get the IV out of my arm. We use that right up till the very end, because on a rare occasion, people, something less than 1 in 10, will experience a vasovagal episode. That's a simple faint. When you remove large amounts of fat, when you reposition people, they've been lying flat for a long period of time, you can have drops in your blood pressure and heart rate and some vagal stimulation that essentially is a faint. And if we have to give you fluids to resuscitate you, we need that IV in right before you walk out the door. So the vasovagal episodes happen. It's not alarming. We deal with it once in a while. It's not to be afraid. Don't be embarrassed if you're a person that faints when you get your blood drawn, for example. You might have an episode after a liposuction procedure when you see your fat in a jar, you see this puddle of red stuff that you're lying in. So the vasovagal episodes are real. We think, and I believe, that we reduce the likelihood of those episodes by putting your compression garment on while you're still recumbent on the exam table. And therefore, instead of just letting you stand up and we pull your compression garment up, we put it on you while you're lying down. And that means it's sometimes necessary for 2 people to be wrestling with an elastic garment. So that's the kind of thing that if you know ahead of time it's going to happen, it won't be disturbing, and you don't have to get mad at my staff for not letting you stand up to put on the garment. Now, hopefully, I've addressed most of the questions and the things that I feel like we don't emphasize enough in preparing people for these procedures. But in case I forgot something in this video, please write me at info@wisemedicalcenter.com, and I'll address these questions in a future video. Also, you can request a copy of 100 frequently asked questions about liposuction. That's a chapter in a book I've been working on forever. And the chapter is available in a PDF that I can email to you. And anything that's not in that frequently asked questions list, I want to put it there. If you have a good question, please submit it. And I promise you we'll add it to our ongoing body of knowledge. Thank you for your attention, and I look forward to sharing more thoughts with you in the Wise Medical Minute.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.